All right, welcome to our next week. We have now moved on to our human anatomy section, where we're going to spend the next 3 weeks talking about different systems inside the human body and looking at that human body from an anatomy perspective. And so here's our 3 weeks. Today we're on our first week, which is support and movement, where we're going to look at bones, joints, and tissues in the human body. So let's take a look. Bones, joints, and tissues. Here's a few warm-up questions for us to think about. Since the first one, how many bones do we have in our body? What are our bones made up of? And how do bones connect to other bones? We'll actually just stay in the main room today and actually just talk about these. How many bones do we have in our body? Any guesses? Does anyone know? Or guesses? What do we got?
I'm for some reason stuck on 300, but I think it's a lot.
300? Okay.
206.
206? Oh, that was an exact answer. It's like 206. Trifana, do you have a guess?
I knew before, but I completely forgot.
Yeah. All right. What about bones and what they're made up of? Do we know the different parts of a bone? What are bones made up of? What's inside bones? What do we got?
Calcium?
I know one thing, that there's a calcium inside the bones.
Yeah, calcium. Yep. And that's where they definitely talk about with people with like osteoporosis, right? To be taking lots of calcium, eating foods high in calcium, drinking lots of more milk, and then also calcium supplements like the vitamins for sure. What else?
Is bone marrow the same thing?
Yes, bone marrow. Yes, bone marrow is the inside. It's one of the parts of the bone. And so we're going to look at a diagram of bones today and actually look at all those different parts of a bone and show you how deep we can really get into when you start studying anatomy at like that nursing level at the university. And how do bones connect to other bones? Connections are very important when we talk about anatomy. What are different types of connectors and how do they connect?
Joints.
Okay, yep, joints is kind of where they connect, absolutely. And do we know any other words? How do
Ligaments?
those joints stay together? What?
Ligaments?
Yes, I heard it. Ligaments is a good word. Do we know any other connector words? There's actually 3 of them that we're going to talk about today that connect things together. Ligaments is one of the 3. There's 2 others. Well, we'll dive in. Hearing nothing else, we're going to move on. So we're talking about the bones, right? That skeletal system, and there are so many of these bones. Maurice was right. 206 plus bones in the human body. Now, a lot of those are actually in the skull, right? When we actually look at the skull, we get really into all these small little fine bones that are going on inside the skull itself. We have the different ribs, we have our vertebrae, but we have, and then also the fingers, right? Think about all the little bones that are in our fingers and our feet, but there's a total of 206 plus bones. The reason why I add plus, because some adults and individuals, like after you have broken bones, you can then have more bones technically, because if it's broken, like especially in like fingers or small areas, you actually now have 2 bones kind of. And so that 206 plus, but yeah, 206 is what the average adult has for bones. And here are some of our big popular bones. We have radius, ulna, tibia, fibula, femur, clavicle, ribs, and phalanges. Where are these located? Let's start with the first one, radius. Do we know where this bone is located? Do we know? Radius. If you remember from last week, we talked about taking someone's vital sign and we looked at the radial pulse because it's along the radial nerve. Where would the radius bone be? Yep, it's actually the arm, not necessarily the wrist, because we have bones going on here in the wrist. Your radial bone is the top part of your forearm. So your forearm has 2 bones, right? There's a top part and there's a bottom part. We have our superior, so our top bone that runs along the top is the radius. The bottom one is our ulna. So we have our radius and we have our ulna, top and bottom, those 2 bones. Our leg does the same thing. The bottom part of our leg is actually 2 bones coming down, but which one is which? We have tibia and we have fibula. Which one's our tibia and which one's our fibula? What part of our leg? Do we know? Any
Is it on the
guesses?
leg? Isn't fibula is on the like kind of part of the hips?
Nope. We're going below the knee. We're below the knee. The tibia and fibula are the two bones below the knee that make the bottom part of our leg, just like our forearm. We're talking about the bottom part of our leg, those two bones.
Oh, below the knee.
Yep, below the knee. So we're looking at these two. So we talked about the radius and the ulna. Radius is our top bone. Ulna is our bottom. We're now talking about the tibia and fibula, which are these bottom ones. One's a lot bigger than the other. Do we know which one is this front bone? Also, some people call it the shin bone, where we feel that shin going right along the top of our leg. That is our tibia. Our tibia is that shin bone, that front bone. And then the smaller one behind it is the fibula. These are very important bones to know because when we're talking about healthcare and medical, these are very commonly broken bones, right? When people have accidents, when people fall, when they slip, they often break their radius or their ulna, their tibia and their fibula, right? They're breaking those bones are very, very popular. The other ones are also popular. We have femur, clavicle, ribs, and phalanges. Where's the femur?
Top thigh?
Yes, very good. It's the big one, right? It's our femur is this bone right here, a really big one right up there is our femur. Doesn't break as much. It's a pretty thick bone and it's protected by a lot of muscle, right? We have our quadriceps, which are these four muscles wrapping around it. That one doesn't necessarily break so much. We see more hip problems, like someone breaking a hip or breaking their tailbone, not necessarily breaking their femur itself. But all right, clavicle. Our next one.
That's up by your neck.
You got it.
shoulder.
Yep. It's up by our neck and our shoulder. So it's this really, and it's a really thin bone, this thin bone that goes right up there along the top. And that's why it also gets broken a lot too, right? We see in car accidents, in falls, horseback riding accidents. It's this really thin bone going right across the top that it can actually get damaged pretty easily, that people can break their clavicle. Ribs. Where are our ribs located?
Abdomen, chest?
Yes, I like it. Good vocabulary. Abdomen and chest. Yep. All these right here. And we have different types. We talked about like the floating ribs, and the ribs are a lot more complicated than just ribs. I've kept it very simple by just saying ribs. There's even like the sternum that connects the ribs. There's a lot going on here that we could focus on when we're talking about anatomy. But we just know the ribs in general are here. The rib cage is all of them. And that happens a lot too. Again, if someone falls, gets a huge impact on that abdomen or side, we can see these rib bones breaking, and very painful. Very, very painful because we use our abdomen for everything. I've actually broken a rib before, and it was one of the more worst pains I've had because you do, like, if you want to move your leg, your abdomen moves first, right? If you want to move your arms, your abdomen still moves. Like, your abdomen is your core muscles because it is the core. Every movement you do involves moving the abdomen. And then you also have breathing, right? That your chest is constantly going in and out when breathing, and it was, so painful. All right. And then last one, phalanges. This might be a new word for all of you. It's pretty specific, phalanges.
It's like fingers?
Yes, fingers and toes. So our phalanges are these little things that we have coming out of our hands and feet. So phalanges, fingers and toes. And I added them to the list because, again, this is that high frequency of broken bones that we see as medical providers. So these are the types of bones you'll be hearing doctors talk about. You'll get x-rays of them. And these are kind of the hot bones that you need to be aware of what part of the body they are when you're working with a patient. So Next, we're going to look at parts of a bone. Like, how can we zoom in and look at all these different parts of a bone and how complex it is? Now, this is a short video. It's like 2 minutes, but you're going to be overwhelmed with a list of vocabulary words. So just strap on and ride this through with me. We will survive, but there's a lot of vocabulary words that they're going to throw at you. And what I wanted this to do is just kind of be an introduction of how deep we can really get when we're talking about anatomy. That when you go on, after finishing a CNA program, moving into a nursing program, you will take human anatomy. You might even take 2 semesters of Human Anatomy 1 and Human Anatomy 2, and you will spend an entire week over bones. You'll spend hours just focusing on all these different parts of bones, the functions of the bones, the purpose of the bones, different illnesses, diseases, and really focusing at that level. And here's the specific type of vocabulary we would get at. So here's just focusing on just the bones. Let's take a look.
Basic overview of the parts of a long bone. The diaphysis is the shaft of the bone, and its function is to be rigid enough to tolerate strong forces and not bend or break. The diaphysis is comprised of compact bone tissue and spongy bone tissue. At each end of the diaphysis is an epiphysis, which is comprised mainly of spongy bone tissue. The spaces of spongy bone tissue contain red marrow, which produces red blood cells, white blood cells, and platelets. You can see at the epiphysis the bone widens out. This is so a joint can be formed with another bone. By the widening out of these bone ends, a larger surface area is created, providing for better joint stability. Where bones come together to form joints is a smooth tissue called articular cartilage. It provides shock absorption, cushioning, and minimizes friction as bones move. Because articular cartilage has a poor blood supply, it does not heal very well once it's been damaged. There is a thin fibrous membrane called periosteum that covers the entire bone surface except where the articular cartilage is. This membrane allows for attachment of ligaments and muscle tendons and houses cells that are important in bone formation and repairing bone tissue. The periosteum has many nerve fibers, so it can be very painful when bruised. Inside the diaphysis is a tube-like area called the medullary cavity, which houses red marrow during childhood and which is replaced by yellow marrow as a person ages. There is a thin membrane that lines the medullary cavity called the endosteum, which contains cells that are important in bone growth and repair. Bones are also well supplied with arteries and veins. And that be the basic parts of a long bone.
All right, thoughts?
It's a lot of layers.
Yes, a lot of layers, right? A lot of words. And my biggest takeaway from this video too, did you hear how he said, and this is the basic information, right? Oh, this is just the basic, just general, everyone should know this. And that's where human anatomy can focus. We can zoom in so much, right? And that's where we get all of these vocabulary words, and it can be very overwhelming. And that is the biggest, I would say, complaint and concern from CNA nursing students, right? It is so much new information and so many new words, right? Diaphysis, epiphysis, the peristosum, right? All of these words that were coming in. Now we might know bone marrow. That's kind of a common word that we're like, we even said at the beginning, like, oh yeah, that bone marrow is on the inside, and just studying what is its function and its purpose. The different types, spongy and compact, right? I know spongy is like a sponge, compact, those are easy terms, but these scientific terms are the ones that are like, ooh, what are they for? And so when you're doing a CNA program or a nursing program, you have to spend a lot of time studying these medical terms and medical terminology. And it just takes time and a lot of focus. You have to be making flashcards. You have to really spend time studying these terms and learning them and memorizing them so you can see them in the readings, you can pass them on tests, and that you can then use them when you're in the medical field. One strategy is really looking for those connections, right? So I see the physis root word, and that is actually a Greek root word for grow. It's growing. So like the bone. So a lot of our bone terminology will have this Greek root word to grow into them. So we have the epiphysis, which is the big part of it, and then the end, this is the ends of the bones, and then that is in the center of the bones. And so we know that if I see this root word, it is dealing with the bones themselves and growing. And so the more you can break up words, the more you can make connections, the easier it is to remember them. But it does take a lot of time and energy into learning all these different medical terms and how to use them. So that's kind of the basic parts of a bone. We're not even going to get into the advanced stuff, but I thought that was actually pretty advanced for the level that we're at right now. So different parts of a bone and what's going on and all those layers inside of them, it's a lot more complicated than just a bone. And the entire human body is that way. Everything we talk about, we can talk about the basic information, but then we can dive so much deeper into it and looking at all those different layers, structures, functions, purpose. So that was bones. We're going to now move on to connectors and those three types of connectors. We mentioned the word ligaments was one of the words I heard. We also have the word cartilage and we have the word tendons. These are three different things, but we use them to connect the human body together. All right, let's start with ligaments. Do we know about ligaments? What are ligaments?
They're kind of like little wires, maybe? No?
I like it. Yeah, like little wires. Absolutely. And they are connecting bones to bones, right? So our bones are being connected by these like little wires, these ligaments that are
Or
connecting them.
adapters.
I think of ligaments when I'm eating chicken, right? If you ever buy like the whole chicken and you have
Yeah.
like the chicken leg and you're biting it and you have those like those little, you can see some of the ligaments in those pieces of the chicken, right? Those little like wires that are connecting the bones to bones. Then we have tendons. And what are tendons? What are they connecting? So here we have bone to bone. What are tendons connecting?
They're connecting the muscle to the bone.
Correct. They're connecting the muscle to the bone, which you also see in chicken legs, right? So you're like pulling that muscle off, and then there'll be like that little white, creamy part, right? That's really hard. That is the tendon that is connecting that muscle to that bone.
We can
There.
call it the adapter, maybe.
Okay. Yep. And then we have cartilage. How could we describe cartilage? We see it here, which again we see in chicken bones when we eat them. Man, I'm hungry. I want some chicken bones.
Kind of like, it's kind of used for friction, maybe, or like to move it around, right?
Yeah, it's to actually eliminate friction, right? It's to make it as
Yeah.
smooth as possible. So it's very, very smooth. It's very slick, so it allows that movement, right? And it kind of acts as kind of a cushion, right? So it's not bone on bone, right? That would be really painful. It is this like soft cushion that's in between, which then allows some fluid and some different things in there to create that joint. This is a very simple aspect of looking at it. So it's kind of that cushion, that pillow. Now, one thing about cartilage is there's not a lot of blood flow going into cartilage. And so cartilage does not heal itself very quickly. And this is where when we talk about people aging, they have a lot of joint issues because that cartilage is starting to wear off, it's to wear down, and they're starting to actually now get bone on bone friction, which is very painful because of those nerve endings inside the bones. And so a lot of joint issues, especially for elderly, has to do with cartilage and it kind of wearing down over time, and the body isn't regenerating or making new cartilage because of the lack of blood flow. And so, yeah, these are our three connectors that we have in bones. Then I wanted to talk about some of the issues that we have breaking bones. And that's why I gave you that specific list of bones, because those are the bones that most often break when you're looking when you're working as a healthcare provider. So what are the different types of broken bones? How can we break bones? How do bones break? What are your
Like
thoughts?
breaking anything else?
Yeah, like, but how do bones themselves actually, like, are there different types of breaks?
Oh, fracture and
So the
then
word
there's a break.
fracture.
Spiral breaks.
Spiral. Oh, that's nasty. right? It's like something got twisted, so that bone goes.
And shattered.
Okay. Here are the scientific, so spiral was one of them. Very good. These are all the different types of fractures that we can have. And fractures is the word we use for broken bone, right? If it's fractured, it's a break of some kind, right? It doesn't mean it has to be completely separated, right? We can have like a hairline fracture, which is a hairline fracture. It's just like there's like a little, it's kind of broken, but it's still together. We have all these different types of breaks that we have. And then in the medical world, we kind of separate breaks into simple, compound, and complex. So we have simple and we have compound. Simple is when it's still inside the body and it's still almost connected, not quite connected. Compound is when it is clearly separated and often that bone pokes through the skin and you can actually see the bone itself protruding the skin. That is a compound fracture. And that's very dangerous. This is ones that medical providers are very concerned about in the ER because the surgery has to be done immediately. These here surgeries don't necessarily have to be done, but they have different forms of treatment, right? They might put a cast, they might reduce mobility, ice, elevation, rest, but with a compound fracture, surgery has to be done, right? The bone has to be put in. They often put screws and plates, and they have to get that bone back into place so it'll heal itself. The other one then are very complicated, which are complex breaks, is when there's more than one break in the bone itself. So those are kind of the three levels that we talk about: simple, compound, and complex breaks in our bones. All right, other medical issues. So when we're talking about bones, here are other medical issues that we often talk about. We have osteoporosis. Have we heard of osteoporosis? This is a very popular one. What do we know about it?
Is that like lack of calcium?
That's a good question. I don't necessarily think it's a lack of calcium, but rather calcium is a treatment for it. So increasing your calcium will help you not develop it, but it's not necessarily because you don't have enough calcium. But here's our definition of osteoporosis. Can I have someone read our definition for us? Would you like to, Eva? I know you've been participating a lot. Would you like to read osteoporosis?
Osteoporosis is a bone disease that occurs when the body loses too much bone, makes too little bone, or both. As a result, bones become weak and may break from a fall, or in serious cases from sneezing or minor bumps. Yikes.
I know, right? And so when we zoomed in on the bone, right, we had that spongy bone and that compact bone tissue, and it looks like this, right? It's like looking at a sponge, right? There's these little holes, but when someone starts to develop osteoporosis, those holes get bigger and bigger, right? And it becomes weaker and weaker. And then those bones get so weak that they're very brittle and they can break very easily. And so you see someone just like the smallest bump or slipping and falling could break several bones. And so it's very dangerous. This often develops too from aging because as we get older, the bones get weaker and weaker. But if it starts getting super serious, that's when it reaches the level of osteoporosis. And that's where I don't necessarily feel it's a lack of calcium, but calcium is often a treatment for it, right? That by increasing our calcium, it makes that stronger, taking it back to that healthy bone where it should be. All right, our next one, osteopenia. Osteopenia. Would someone else like to read this? Christina, would you like to read? Are you able to read?
Sure. Osteopenia is a condition that begins as you lose bone mass and your bones get weaker. This happens when the inside of your bone becomes brittle from a loss of calcium. It's very common as you age. Total bone mass peaks around age 35. People who have osteopenia are at a higher risk of having osteoporosis.
Very good. So this is kind of like step one, right? And a lot of diseases are this way too that we talk about them, like diabetes is one of them too. Hypertension, right? That we have these different levels, these different stages of them where we see those early warning signs and then it develops and develops. Osteopenia is the same way. This is kind of like that on-site, right? We're seeing bigger and bigger holes, right? It's becoming weaker and weaker before it actually reaches the level of osteoporosis. 35. Making me nervous here. Our total bone mass peaks at the age of 35. Man, I'm getting old. I feel it. All right, and then our next one, osteitis deformis. Trifana, would you like to read this one for us? It's also known as Paget's disease.
Okay. A chronic disease of elderly people characterized by deterioration of bone tissue, especially in the spine, skull, or pelvis, sometimes causes severe pain.
Yeah, so this is another one of that idea of we see it here. So here's a picture of a healthy bone, and then we start seeing again a lot of those holes, that deterioration where it's kind of falling apart. So these are all very similar. And notice, do we see a root word that is similar in all of them?
Osti.
Yes, right? And so again, we're looking at, when we see this root word, we know, we're dealing with the bone and what the bone is made up of, right? And so we're like, oh, there's obviously something, this disease is dealing with the bone marrow and the actual, like the makeup of the bone, the density of the bone. Absolutely. Here's another one. This illness is called scoliosis. This is a very common illness as well too. Have we heard the word scoliosis?
I have. One of my cousins had it.
Yep, very common. Trifana, what is it? Could you define what is scoliosis?
It's a deformed spine, kind of like it curves. Not really.
Yes, exactly. So, So here in this picture, we have a healthy spine, right? And it's a very straight line, which I can't draw this morning. Very good. And scoliosis is there some type of a curve or a bend. And we have different types, right? We see some people with more of a curve where it's like hunched over, and we see that curve there. We can see a lower curve in the lower back. We can also see this kind of like S curve there. There's different types, but a curvature of the spine is scoliosis. And that is a very common illness too. All right, so that is bones. We're now going to move on to our next section, which are the joints of our body. All right, what are the different joints in our body, and how many types of joints do we have? What do we got?
Probably more than we have bones, I would think.
That's a good question. Because if joints are where they connect, would there be more joints or more bones? I think there's more bones than joints, to be honest, because you think about like multiple bones all coming at the same joint, right? You know, you have like the two bones coming in, and then what is that actually? Are those all, anatomy might actually define each of those as different connected joints. Let me search. I'm going to ask Google. That's a great question. We have 250 to 300. The actual number of joints as a person depends on the number of variables. It's estimated that there's 250 to 350 joints in the human body, which would be more because there's 206 bones, 250 joints. Absolutely, your logic was completely correct that if it's connecting bones, there has to be more connectors than actual bones themselves. Absolutely. What are some of the joints that we know of? Like, what are some of the really popular joints that we talk about?
Tendons?
I mean, tendons is what connects them, but that forms a joint, right? So the tendons are connecting bone, ligaments are connecting bones to bones, tendons are connecting the muscles to the bones, but the actual joint itself, which is the structure that allows for us to do movement.
Hinge,
What?
like a hinge joint.
Yep, like a hinge joint. And can you give me an example of a hinge joint in our body?
Elbows.
Our elbow, yep,
They go
exactly.
one way.
So here we have this joint, right? And it hinge, right? It moves in one direction. Broop, broop. That's it, right? That's the only thing that elbow can do. That's a hinge joint. Yep. What's another type of joint or part of the body that's a joint?
Our neck that pivots inside the
Yes, right? It turns all the way around, right? It can do this, but it can also do this, right? Like there's a lot of movement that goes on. It can go, it turns this way, but it can also turn up and around, right? That way there. So, yep. Our neck is one. What's another one?
Our ankles, our knees.
Yes. So our knee, what would our knee be? Our knee is similar to our elbow. So we have that hinge joint, right? Our knee is the same thing. It just works the other way, right? So there's that hinge in our knee. Ankles are a lot different, right? We have a lot different mobility in that ankle, right? Think about all that movement, right? You can come up and down, but you can also go just like our wrist, right? Up, down, around, right? All that movement is happening there in the wrist and the ankle. Same thing. So that's a different type of joint. What else? We got
Ball,
one other big one that we haven't talked about, and we got
ball
four
and
of them.
socket joint.
Yes, the ball and socket, right? So you have the socket and the ball that goes in there that allows this kind of circular motion. And give me an example of one in our body. Ball and socket joint.
Is it the one on our knee?
No, not our knee.
Elbow.
Not our elbow. Elbow is going to be our hinge.
Ball and socket. Ball and socket.
Ball and socket.
The wrists.
Nope.
Is it from the leg to the hips?
The hip, right? We're focusing more
Yes,
on the hip
hip.
here. Yep.
Hips.
Shoulders.
Our shoulder, right? So when that arm goes into our shoulder, that is a socket and ball joint. So that's why our shoulder can do this circular motion, right? It can come up and down, and it has this circle here, and it can kind of rotate that. Actually, that's a different part of my body. Our hip does the same thing. Our leg does that little like circle, right? It can go anywhere in that motion. All right, so we have a total of 6 different types of joints. Pivot joint, like we were talking about in the neck, right? That allows that rotation. The ball and socket that we were just talking about, like in our hip or in our shoulder, where it allows that circular motion. We see a hinge, like we were talking about in the elbow and in the knee. We see a congoloid joint, which this one between the radius and, so this would be like the wrist here. So it allows a lot of that like gliding motion, right? Plane joint. And then the other one is our saddle joint, which the common that is I think our thumb. Our thumb is an example of a saddle joint, because if you think about our thumb, think about all that movement that thumb can do, right? Like it has a lot of movement that it can do. That saddle joint. So these are our 6 different types of joints that make up all those different connectors in the human body. And when we're talking about joints, one of the major medical issues that we talk about is arthritis. Thinking about arthritis. Who would like to read our definition of arthritis?
I can do it.
All right, go ahead.
Arthritis is a genetic term for inflammatory joint disease. Regardless of the cause, inflammation of the joints may cause pain, stiffness, swelling, and some redness of the skin about the joint.
Absolutely. And this is another one that we see with older patients, right? As we get older, a lot of people develop arthritis, these like painful joints. The only thing though is arthritis can often, it's hard to diagnose arthritis because the concept of painful joints is a symptom in so many different diseases. There are a lot of diseases where painful joints is one of its symptoms. So it's hard to decide, is this just arthritis or is this a warning sign of some other type of disease? Is it osteoarthritis? Is it lupus? Is it from Lyme disease? Like, are there other things going on that are causing these painful joints? But yeah, pain in joints is probably like the biggest medical problem. Another one, as I talked about before, is with the cartilage, right? That's also creates an issue too, that cartilage gets withered down and that people need either shots or injections or different things to help with that. We also have joint replacement. Like you hear people getting like hip replacement surgery or shoulder replacement surgery where they actually make an artificial ball, a ball and socket joint and actually put it inside that person to give them a new, nice and smooth joint that eliminates all of that pain and discomfort for them. When we're talking about joints as well, sprained and twists is what we're talking about. It's like sprained ankles, sprained wrists, twisted ankle, all kind of the same things. We have different types, inversion and eversion. Tell me about sprained or twisted ankles. What does that mean? And have we experienced them? I think we've probably all have experienced this at some point in time, right?
I've had a few.
Yeah. Mm-hmm. I mean, if we just step on it wrong, twist it, and what happens when that happens? What do you experience?
We just pull the ligament
Yep.
too much.
Mm-hmm.
Is that
Yep.
what it is?
Yeah, you kind of pulled the ligament. It could be a ligament, it could be a tendon, and we just definitely stressed it. And so you see inflammation, right? It starts swelling because that's the body trying to protect itself, right? So you see that inflammation, you see that swelling, and something's either gotten torn, stretched too far, but it's not broken. We don't have separation. We don't have things that are broken. It's just really strained and stressed and stretched too far.
I heard that twisting ankles was actually worse than breaking. Is that true?
I don't know about that. That's actually a good question.
Because I grew up on crutches, I always kept twisting my ankles. So
I know it's harder to treat and heal sometimes because like when it's a broken bone, you know for sure, like, all right, here's the bone, and then you can make what I mean, you can put an action, like you can put a plate in the screws and really kind of fix it and let it heal. You can put it on a cast. Sprained ankles, there's not much medical providers can do, right? And that's what we'll talk about here. Is this is kind of the advice that we offer people, right? When you have a sprained ankle, your options are rest, ice, compression, and elevate, right? That's the best things you can do. And that's what you tell patients. And sometimes it's really frustrating because they like want something more, right? Like, give me something, give me a cast, give me surgery, give me something. And sometimes the answer is you just need time, like rest, stay off of it, use ice to reduce that inflammation, compression, right? Keep it wrapped up and keep it tight to stop swelling, and then elevate it, keep it up off the ground. So again, for blood flow and circulation. And that's the best treatment that we can have for a sprained ankle. And why I also think people say that like sprained is worse than broken, because I think patients too, when they have a sprained ankle, they may not be fully healed yet and they push themselves too far. They're like, well, I can put pressure on it, I can walk. And then they do too much and they end up hurting it again.
I've done that before.
And I think that's why people are saying, that's why you hear that idea of like sprained is worse than a broken bone, right? Where when it's broken, they have to put in a cast. There often has to be a surgery. And I think the patient often takes it a little more seriously, right? Because there is this cast, and they're like, oh, Where with when it's just a sprain, if the advice is rest, ice, compression, and elevate, well, for how long? 2 days from now, I feel fine. So I'm going to go outside and chop firewood. And now it's worse, right? And so you see, I feel that's kind of the issue, is the treatment options. But these are 4 terms that we need to know. And these are the advice that we give for injuries like this is rest, ice, compression, and elevate. All right, so that is joint. So we've done bones. We've done our different joints of all those connectors. Now we're going to move on to tissues and muscles throughout the human body. We now have even more. So we're kind of going from small to bigger, right? Now we have all of these different muscles. For each bone, we have multiple muscles going around it, right? We have our bicep and our tricep. Bicep are these 2 muscles, bi meaning 2, tricep meaning 3, quadricep meaning 4, right? We have all these different muscles that allow us to do all of this movement and strength that we see in the human body. When you step into the anatomy level at university in the nursing program, you are going to get so focused. There are 4 different types of tissues, and you will spend over a week on each of these different types of tissues. And you'll dive deeper into them. Today, I wanted to focus just on muscle tissue itself, because that's kind of that big picture that we're looking at, right? All of those muscles that we have in our human body. All right. What are some of the muscles that we know of?
Glutes.
All right, our glutes, right? Our gluteus maximus, right there. Yep. What else do we got? I
Abs.
mentioned a few already. Yep, our ab muscles, our abdominal muscles.
Pectoral.
Say that again.
Pectoral.
Yes, our pectoral muscles. In our chest.
Tricep, biceps.
Yep, biceps are those 2 muscles. Triceps are the ones, notice how there's 3 of them, right? 1, 2, and 3. Triceps, biceps are 2. And that's why we have those words bicep, tricep, and the one in the leg.
Rectus abdominis muscles, hamstring.
Okay. Yep. We have our quadricep, these 4 muscles here on the top of our leg, and then the back is our hamstrings, is what we call too. So again, we have all these muscles that are going on. When we talk about muscles, though, we're looking at the skeletal muscles, right? They're the ones that we see, are these really big ones that we all know and we talk about. But there are different types of muscular tissue that we see. We have all of the cardio, the ones with our heart, our cardiac muscular cells of all of those muscles that are pumping blood through our entire system. That'll be, I think, in 2 weeks. We'll focus specifically on just the cardiovascular system and really dive deeper into all of that. And then we have smooth muscle cells is what a lot of our organs are made up of on the inside. Like here in this diagram, we're seeing the stomach is made up of smooth muscle cells. And these work a little bit differently, right? Their function and form is a little bit different, and you will dive deeply into those. But if we're sticking with just those large skeletal muscles, this is what they look like when we zoom in on them and look at all those different layers. So again, kind of the big takeaway, lots of vocabulary, right? Lots of terms, lots of vocabulary words. And when you are a nursing student or even wanting to go to med school, you'll have to know these terms, be able to label them and actually talk about form and function. What are they made up of? What do they do? What is its purpose? All of these things have a specific job to do. And how can those jobs go wrong? And how, as medical providers, you can fix it. Like, what's going wrong and how can we fix it? For CNAs and nursing, you will spend a lot of time on the human skin. Huge, because that's what we think about a lot, right? Because it's on the outside. The human skin is not a muscle. It technically shouldn't be in this unit, but I snuck it in here. The skin is actually an organ, and there's different parts to the human skin. They will talk about all these different layers. The big takeaway words is this one here, the epidermis, the dermis, and the hypodermis. What root word do we see in all three of those?
Miss. Dermis.
Dermis, yep. And they just gave it to us in that one. That one is the whole word, dermis, right? So dermis means skin. So we have these different layers of skin. That dermis, we have the epi, meaning above or top, like the epicenter, the center of it. And then we see hypo, meaning below, like hypothermia, below temperature. So we have the dermis, we have the epidermis, and we have the hypodermis, what's below it, these different layers. And so again, that's one strategy that you can do is kind of, find those root words. I know the word dermis is skin. I have to remember that. So then when I see the word hypodermis, it means below. Epidermis means above it. And I can start making those connections with those root words. And it takes time. It takes a lot of focus and study of studying and memorizing these vocabulary words. Now, if we zoomed in on the epidermis, just that top layer, right? So I'm talking about this right here. If I zoomed in on that, this is what we see. Oh my goodness. Look at all those layers. And so again, when you're looking at anatomy, these are the two things that we focus on: features and function, the two F's. Features are what is it made up of? How does it work? And functions are what do they do? Like what's its purpose? All of these have a purpose. They all have something to do. They have a job to do. And all of those jobs are equally important because by working together, that now makes this nice, healthy skin. And when something is not working properly, that's where we start to see illness and disease. Something is not doing its function properly. And so that's what we're studying. You will actually look at all seven. There are 7 layers to the skin, and you will look at the features of all 7 of those layers and the function. What are their jobs and what are their purposes? And you will have to know the features and functions of all 7 of those layers when you take the skin chapter in the human anatomy textbook. So again, a lot of words, a lot of terms, and a lot of vocabularies. But why is this important? Why are nursing students and CNA so focused on the 7 layers of skin and its features and functions? What will you see in the hospital as a medical provider that makes this information important?
Examining your skin will answer a lot of questions.
Okay. What are some of the things we examine skin for? Can you think of, like as nurses and doctors, what do we examine the skin for?
Disease.
Or why?
Like pressure sore.
Oh, I couldn't say that again.
Sores like pressure sore. Something like that, like bed sores.
Yep, bed sores especially. Yes,
like wound on the top of the skin.
Yep, especially if someone's hospitalized for a long period of time and they're not moving and they're sitting and staying in their bed for a long period of time, they can develop bed
like
sores.
Yeast and stuff in some areas.
Okay, yeast, yeast infections. We also see like fungal, like things like athlete's foot or things like that. But there's a bigger one. There's a huge one that we're missing about the skin as medical providers. Are you guys ready? Burns. A lot of people come into the ER with different types of burns. And understanding how the skin works determines if we classify this as a 1st degree, 2nd degree, or 3rd degree burn. Because the different severities of burns are damaging different layers and different amounts of the skin. That's one classification, is how much of the skin is being damaged, how much of the skin is losing its ability to function. Or the other thing we look at, and you'll learn about this when you actually do the CNA training, is how much of the body is burned. they actually give different percents, right? So you have one arm and you have another arm and you have a leg, a body, and a head. And those are all valued at different amounts of percent. And depending on where the burn is located, depending on how much of the body is burned, will change the severity of the burn. Like it might actually be 2nd-degree burns when you're talking about the layer of skin, but if it's on like both legs and arm and part of the torso, it'll be upgraded to a 3rd-degree burn just because it's affecting more parts of the body. Does that make sense?
Yeah, that makes
Yeah.
sense.
That makes sense. So there are two things going on. We look at the how much of the skin is being damaged and also what parts of the body are being damaged and how much of the body is being damaged with these burns. So that is something that you will see as working in healthcare, are identifying and classifying types of burns on human skin. But yeah, that's why I added it on there. And so, yep, so those were our 3 sections that we focused on today. We had all of our bones in the human body. We had our 6 different types of joints in the human body. And then we looked at these different types of tissues. We really just focused on just one of them, muscular tissue, and we didn't even really get that far. And then we looked at the skin and we kind of dove into some of the vocabulary that we will see, the epidermis, the dermis, and the hypodermis, and how those even then break up. We zoom in into even different levels. Most of this here, all of this right here is actually all in the epidermis, I believe, because we see the dermis down here, right? So this is all just that top layer. We can do the same thing for the dermis and the hypo. Look at how much is going on in the hypodermis itself, right? Like that's where the blood vessels are. That's where, we see a lot of going on here too. And so my main thing is this idea of vocabulary. When you do the CNA program, when you do a nursing program, they are going to throw vocabulary words at you, and it's going to feel like drinking from a fire hydrant, right? They're going to open up that fire hydrant and just throw words at you, and they're expecting you to catch as much as you can. So, what are some tips for studying vocabulary? What are ways that we can study vocabulary more effectively?
Repeat them, write them over and over.
Repeat them, write them. A lot of research suggests, especially since I'm a language teacher, I'm really fascinated in how do we learn words. And a lot of scientists are saying it takes us 7 times of saying a word, hearing a word, reading a word, and writing a word, 7 times for us to convert it into our long-term memory, right? We have to use that word 7 times before it's in there for us to access again later on in life. 7. So repetition, repeating over and over again. All right, what else? What's another strategy and tip for studying vocabulary?
Get the root words.
Yes, you can dissect them, right? If you can figure out little clues of, ooh, I see this and this tells me this word means this, you can start making those connections, right? Identifying root words, identifying prefixes and suffixes to see if you can't discover what does this word mean. Because as humans, right, when we create words, we take already existing words and put them together when we need to create a new word. And we see that in the medical field, that when scientists 200 years ago, 150 years ago, were making all of these words, classifying all the different parts of human anatomy, they used already existing words. They took words from Greek, they took words from Latin, and they put them together to build these new words. And if we can understand those small building blocks, we can put them together a lot easier. That's a great tip. Other tips and strategies.
Flashcards.
Flashcards. I love flashcards. I make flashcards all the time when I'm trying to study vocabulary. That lets you do it the 7 times, right? Because again, you have to see it, you have to hear it, you have to read it 7 times to get into your long-term memory. So the more you can practice with flashcards. Any other tips? All right. Well, I have a list of tips, and you ladies actually, there's only a few that I came up with that you didn't. Like, don't study for too long of a time. So, what this means, there's a lot of research going on with adults and adult learning. And what research is suggesting is spending shorter amounts of time more often is more beneficial for learning than spending a lot of time only once or twice. And that's what's affecting class sizes in adult education right now, that we're actually finding it is more beneficial to have a 30-minute class 4 days a week than two classes that are both an hour. That's the same amount of time, right? 1 hour, 1 hour. But by spending 30 minutes, 4 days a week, you actually learn and access the material more often. You get more practice. You're seeing and hearing and reviewing those vocabulary words more often. And that is a suggestion to do when studying vocabulary. Don't sit down and say, well, I'm going to spend a whole hour studying vocabulary. Don't do it. Do 5 minutes, 10 minutes, but do it every single day. Right? So if you have that test that you know that's coming up 2 weeks from now in your human anatomy class, have your flashcards, have the things that you're studying, and do it daily for a short amount of time. 5-10 minutes, go through and practice, boom, done, move on. Come back to it tomorrow, see him again, move on. Come to the next day. And it's that repetition and practice that will really solidify it into your memory. And it's so beneficial. So many students wait to the last minute and say, oh, I have the test tomorrow. I'm just going to sit here for 2 hours and just study vocabulary for 2 hours long. It will not transfer into your brain. Does that make sense?
Yeah, that makes sense.
Make sense?
I've done it
And
before.
so, yep. So the more you can stretch out your learning and make shorter chunks of time more often, the more beneficial it will be for studying. All right. Tip number 2, you said it, flashcards. Flashcards, especially here in medical, because there's so many words, right? So many terms, so many root words. The more flashcards you can make and the more often you see them quickly, read them, hear them, say them, the more you'll actually learn them and get into your brain. A website that I like going to is Quizlet. Have we heard of Quizlet before?
Nope. What is it?
Quizlet is this amazing website that students and teachers use, and it is free. And this is what it looks like. I just clicked on the link to take us here. Let me open it up here so you see the whole thing. So it is this website, right, that you can go home. And what's nice is that you can search for flashcards that people have made already. You can make your own, or you can search to see if people have made some already. So what I did is I just searched and I typed in bones, and I found one with 249 flashcards of all the different bones in the human body, right? So it's all these vocabulary words about bones. And so we see it, and if we click on it, it actually flips it over and gives us a picture and definition. And so then I'll go to the next one. Let me go. Like I said, there's a lot of bones. We only hit some of the major ones. But the Atlas C1, I flip it over and it says, it's that part of the bone. Okay. The Axis C2. So again, we're talking about like the hip bone. The cervical vertebrae. Cervical vertebrae. Cool. Right? And this is a free resource online. And you can type in anything. Let's type in CNA. So 231 CNA terms, 64 CNA terms, 64, 58 CNA terms. Let me do the first one with 231. Again, free resource was just Quizlet.com, DON. So this one's going to focus on abbreviations. What does DON mean? Any guesses? Any ideas? I don't know either.
Is it duty on nurse? Or
the director of nursing, the DON. OBRA. That is the Omnibus Budget Reconciliation Act.
Reconciliation Act.
I have no idea what that is.
Uh-huh.
OSHA. Oh, we do know OSHA, right? That I know what it is, but I don't know what it stands for. I mean, I know what it stands for, but I don't know the individual words. Occupational Safety Health Administration. They're the ones that create all of the rules and regulations of where chemicals can be stored and how, and all those safety things with workers, right? Occupationals, working safety. CNA, we know that one. If we don't, I'm going to quit my job.
Certified nurse.
I'm quitting. I'm quitting right now if you don't know this one. What do we got?
No, Sean.
You don't know? Oh, I quit. I'm done. No more.
Just kidding.
All right. And so like I said, this is a website where, and what's nice about it is you can create your own. So if you have a list of words that you're specifically studying, so like say you are studying chapter 6 and it's all on just the skin itself and the different layers of the skin and the layers of those layers and its features and functions, and you have all these vocabulary words, you can go into Quizlet and you can create your own group of flashcards that's digital. You can get the Quizlet app on your phone. So when you're there on your phone, you could just go through it for 5 minutes, 10 minutes every day, put it away and study that way. This is a great tool. There's a bunch of things that are already made, or you can create your own. There is a paid service. Notice how it says upgrade free 7-day trial. I'm not sure the difference between the free and the not free. I always use the free one. We're looking at the free one right now. I think if you actually did the paid one, there's even better things. But I've only used just the free version, which is pretty cool. Yeah, so it looks like this one is all the abbreviations. So this is what, 231 abbreviations for CNA. The CDC, the Center for Disease Control, HIV, AIDS, HPV. So all these abbreviations that we're seeing in CNA training, you will see here. So this is a way that you can just practice them. AX auxiliary. So that was my study tip. Quizlet. Number 2, flashcards. You can make your own or make digital ones, but the big thing to keep in mind is don't invent things that are already invented, right? Like you don't have to, I mean, you could. There is one thing about actually sitting and writing them, right? Actually writing them on flashcards is the part of the learning process too, right? You can sit down for an hour and make all of your flashcards to then study them, and that helps people remember them too because you're writing it and reading it. But if you don't have the time to sit down and create those flashcards, someone else has already done it for you. You can even buy pre-made flashcards. If you go to Amazon and type in flashcards for nursing or flashcards for CNA training, you can buy a pre-made bundle of flashcards that will have all of the vocabulary words and terminology you need for CNA training. So the resources are out there. Great study tip. Number 3, you guys mentioned it too, make those connections, look for those root words. Like we saw these 3 terms today, dermis, epidermis, and hypodermis. What does that mean? What is dermis?
Skin,
Yes. And the hypo?
bottom,
Yes, and we know hypo means below, right? Because of hypothermia. So we're making those connections. That now helps us remember that the next time you see dermis and hypodermis, you know dermis, hypodermis, making those connections. So the more you can do that, the better it'll be too. The more it'll stick into your brain. Your brain loves connections. That's actually what your brain does. Your brain basically is just connections, right? That you take things and you connect it to other things that you know, and you take something and you connect it to all of these past experiences and past knowledge, right? We make all of these connections, and that's what your brain is doing. The more you can be conscious of making connections, the more connections your brain will make, and the more it'll actually stick into your long-term memory, and you'll have access to it. So connections, so important. Here is a tip that none of you mentioned, but really knowing you as a person. How do you learn best? How do you study best? Do you need visual pictures? Are you a very visual person? I'm visual. I love pictures. I love images. Every time I study vocabulary, when I make flashcards, there's a picture, not just a written definition, right? I want to see it. I want to see it. I want to label it. I want to see those images. Are you more of an auditory learner, right? Do you need to hear it? Do you need to hear recordings of the vocabulary words? I think we can see that on Quizlet, that there's actually recordings that you can hit play and it'll read the words to you. That might be in the paid version, but you know, maybe you need to hear the words. And then kinesthetic, are you a person by doing, right? That if you're trying to learn the different names of all of the bones, do you need to physically do it and say, all right, this is the radius, this is the ulna, this is my clavicle, and actually physically move, and that physical movement helps you learn better. How do you learn? And what are your different modalities of learning? And that's something to think about. One of my activities today, or one of my activities this week, I think, deals with the modalities of learning. Actually, no, it doesn't. I take that back. Pictures. Again, I'm kind of biased because I am a visual learner. The more you can connect these words to pictures, the more it'll actually stick into your brain. Because our brain loves pictures, especially mine because I'm a visual learner, right? And by making those connections, making those images, we're able to see epidermis, dermis, hypodermis, different layers of the skin. Dermis means skin, and I'm making all of those connections. All right, and my last tip, mnemonic devices. The M is silent. Mnemonic devices. What are mnemonic devices? It's basically a device or a tool to help us get something into our memory. And I'm sure you've done some of these before. So it is a device, a memory device for, or a learning technique that aids in information retention and information retrieval. That's the actual definition. And so what I want you to do is think of this image, close your eyes and think of a person with a sprained ankle, and she is resting her ankle on a huge bowl of rice, right? Create that image in your mind, right? So we see a bowl of rice, we see this sprained ankle, this ridiculous image, put it in there. This is now becoming it's a mnemonic device. So why did I do a bowl of rice? Well, these are the things we have to do. R-I-C-E, right? We need to rest, we need to use ice, we need to use contraction, and we need to elevate. I don't think contraction was the right word.
Compression.
Compression, thank you. That's what it is. But I knew it started with a C. So rice, right? Rest, ice, compression, elevate. Rest, ice, compression, elevate. So by creating that image in our brain of a bowl of rice, a person's ankle there, now when it gets to the test and I'm taking the test and the test says, what are the things you need to do to treat a sprained ankle? I go, bowl of rice, rice, R-I-C-E, rest, ice, compression, and elevate. I know there's 4 because it's the 4 letters of the word rice. And I see this image of a bowl of rice and a person sitting there. By putting that in your brain, you will not forget this information, right? We made so many connections in our brain that it's stored instantly into that long-term memory that we'll be able to retrieve that when we're taking a test or when we need that information. Rice, rest, ice, compression, elevation. Does that make sense?
Yeah.
So these are mnemonic devices. People use acronyms, they use numbers, they use images, but this is a way too of how can I make enough connections so I can remember the information that I need to remember, that I can retrieve the information when it's time to take a test or when I'm studying to get my certification for the actual CNA. So this is another trick to help you study all those different vocabulary words, a mnemonic device. Got it. All right, and that is the end. That was Unit 5, where we're looking at support and movement. We're looking at all those bones, joints, and tissues in the human body. Next week when we come back, we're going to start looking at these things here. We're going to really focus on the respiratory and the digestive system, and we're going to look at the nervous system and the cardiovascular system over the next 2 weeks. All right, if I look at our homework for this week here, I have one quiz that'll be a diagram of the bones of the body, but just those major ones that we talked about, the ones that are most likely to be broken, that we will see as medical providers. I have an assignment, a reflection for you to talk about broken bones, on if you've broken any bones, if you have any family or loved ones that's broken bones, and what was it like? What was the treatment options? How long did it take to heal? Just a reflection that you can write about. I have a joint quiz. So we have those 6 different joints and you have to label them and give examples of those 6 different joints. And then I have a little reflection on mnemonic devices, specifically at the one we just talked about with the bowl of rice, right? Rice, R-I-C-E, rest, ice, compression, elevation, and how learning those types of devices can help us learn terms and vocabulary to pass the CNA exam. I have the presentation slides here. I'm also going to upload an additional reading from our anatomy textbook, which will be chapter 6, which is all over human tissue and muscles. And I think bones are also in there too. And that kind of shows you that glimpse of that anatomy textbook, that if you do the bachelor's degree, that 4-year program to get your nursing license to be that RN, these are the types of materials you'll have to read through to complete that university program. All right, that was the assignments for the